Hi, this is Dr. Elizabeth Owings. I want to talk to you today about women's sexual enjoyment. The current research is that up to 40% of women are experiencing some degree of distress, of sexual distress, and we actually know that this may be even more common in younger women than it is in older women. So women ages 20 to 29 may be experiencing more distress than women ages 60 to 69. I bring that up because I think there's a common attitude that as women approach menopause, that there is this expectation that things are going to become more uncomfortable, and in fact that's what we're seeing. That's our number one complaint from our hormone patients. They love their husbands dearly and they want to be tender towards him, they want to experience joy in the bedroom, but the bottom line is they're experiencing pain. So there's a lot of distress out there, and we're seeking to treat that. There's some new things that are available now I just want to share with you today. Briefly, covering all the evidence, we know that only 14% of women are ever going to talk to their doctors about their degree of sexual distress. They may feel perhaps that there's nothing to be done, there's no hope. If they're entering menopause, or even premenopausal women now are having more and more menopausal symptoms, they may feel like, well, they'll just have to deal with it. This is really surprising to me, given the fact that we've got very effective therapies to restore the hormonal milieu to something that will have women comfortable at all ages and feeling like themselves, feeling like vibrant, healthy, alive, sexual women. So briefly, hormones, there are various ways that hormones can be packaged. Some people are able to take pills and they're more comfortable with that regimen. There are creams or things that can be compounded and utilized that are absorbed through the skin, and that may be useful for some people. The pellets are a way that something is compounded and it's actually inserted under the skin, and these will last, instead of a daily dose, you would need only 4 or 5 insertions of pellets per year. Now you want to go to a qualified practitioner who's got experience with the insertion as well as with managing the hormones and is very familiar with concepts of, say, estrogen and progesterone balance and imbalance, because we know that many of the symptoms that have been treated for years under the auspices of the drug companies as estrogen deficiencies may merely reflect an imbalance between estrogen and progesterone. Testosterone is an extremely important hormone. It's associated with men, I think, the most, and their levels are much, much higher than a woman's levels will be. But that is one of the most important hormones when it comes to sexual drive and comfort, as well as for the men. Much lower levels are needed for women, but it's got to be there, or this is not going to be a happy woman. So once we've addressed the hormones, we still find there are a number of women, they may have perfectly normal hormone levels, but they are not satisfied in the bedroom. They are not able to achieve climax with any ease, and that's the next topic that I wanted to cover with you. So briefly, there is a new technique, and this has been studied extensively using what's called a female sexual distress scale. This really looks at what symptoms women are experiencing. They may have pain, they may have dryness, they may have the inability to even achieve a climax. All of these things are going to play into their comfort and their enjoyment, and that's what this is about. If you're in a committed relationship, you want to be able to enjoy a sexual event with your partner with mutual joy. So that's what we're talking about now. There is a product, it's called platelet-rich plasma, and we're able to use that to actually improve a woman's sexual response and sexual function. Now, briefly, the FDA has approved this little pink pill. Men had Viagra for years, and now we've got this little pink pill. The pink pill doesn't do anything regarding sexual response. All the pink pill does is tell your brain that you want sex, but it does not allow you to be more comfortable or better able to achieve a climax during that sexual encounter. So what this O-shot actually does is what we're talking about. Platelet-rich plasma is derived directly from a patient's blood, and it takes the growth factors and the rejuvenation factors that have been studied extensively in every other area of the body, and now we're able to use this for sexual health and regeneration. The platelet-rich plasma, for example, has been used in orthopedics, in joint healing, All of your professional athletes have probably had injuries that have been managed with platelet-rich plasma at one time or another. The orthopedic surgeons have been using this, and what we find is that it's helping regenerate tissue. The tissue after the injury and after the healing with platelet-rich plasma is better than the tissue was before. So what we're finding in women is that they're better able to develop and maintain lubrication, they're better able to achieve climax, and they're better able to enjoy what is so important in a committed relationship. Thank you so much for listening to me today.